Okay, 45-year-old patient, male, presents to clinic. Okay. Hi, Mark. What brings you in today?
I've noticed that I have blur when I read.
Okay, so is this all the time?
No, it only happens when I'm reading.
Okay, but it happens all the time when
Yes,
you read.
every time I read.
Every time you read. Okay. Um, do you know when this started to happen?
I want to say it started about 2 years ago, but I've noticed that it's kind of been getting worse over time.
Okay. So is this both eyes or?
It's in both of my eyes.
And do you notice is one eye worse than the other?
No, they seem about equally blurry.
Okay. And does this usually happen the whole time that you're reading, or do you find it comes in and out of focus?
Usually the entire time I'm reading.
Okay. Do you feel like there's anything else that you notice other than the blur when you're reading?
I definitely notice that my eyes get tired and that my arms get tired also because I have to hold my reading material farther away.
Okay. And have you tried anything to try and relieve this? Have you tried over-the-counter readers?
No, I've only tried holding my book farther away or whatever it is I'm reading, but it seems like my arms aren't long enough.
Okay. And if you had to rate this, can you make out the words like with a little bit of effort, or do you feel like at this point it's getting very, very difficult?
It's pretty difficult. I have a hard time making out words when I hold my paperwork at the full distance of my arms.
Okay. So when was your last eye exam?
I would say it was about 5 years ago with Dr. Lee.
Okay, and where was that?
It was at Dr. Lee and Associates.
Okay, and do you remember if Dr. Lee had mentioned any abnormal things or any areas of concern at your last exam?
No.
Okay, and have you ever worn glasses?
No.
Contact lenses?
Nope.
No. Have you ever had any ocular surgery?
No.
Have you ever had any other types of ocular treatment, like vision therapy or maybe patching as a child?
No.
Okay, and have you ever had any eye injuries that you
Nope.
can remember? No? Okay. Have you ever experienced flashes?
Nope.
Floaters?
I've noticed maybe a few floaters, but it's never bothered me.
Okay. Have you ever had double vision?
No.
What about burning or itching, maybe redness or tearing?
No.
Have you ever had a random loss of vision?
Nope.
Okay. Do you know if, I'm assuming you said that Dr. Lee said you had a pretty unremarkable exam last time, so you don't have macular degeneration, glaucoma, any retinal issues, anything
No,
like that?
Not that I can think of, no.
Okay. And when was your last physical exam with your doctor?
About 6 months ago.
Okay, and who was that with?
It was with Dr. Smith at his private practice.
Okay, and did Dr. Smith bring anything up that he was concerned about?
He just mentioned that I do have hypertension.
Okay. And are you taking anything for that?
Yes, I'm taking Latrell for
Okay,
it.
and are you taking that the way that it was prescribed to you?
Yes, I'm keeping up with it.
Okay, good. Are there any other medications you're taking?
No,
Okay, and are you allergic to any medications?
just penicillin.
Okay, and are you allergic to anything else, like any environmental things?
No seasonal allergies.
Okay, that's good. What about your family? This is pretty important. Do you have any blood relatives, such as your parents or any siblings that have had macular degeneration, glaucoma, retinal issues, or blindness?
My mom has cataracts, but that's the only thing I can think of.
Okay. What about their overall medical history?
Both of my parents have hypertension as well.
Okay, and nothing other than that, I guess?
Nope.
Okay. And as for yourself, have you ever had any, or how are you feeling today? Have you had any, changes in your health recently?
I have recently lost a lot of weight. I was previously obese. I lost about 65 pounds, but I still have hypertension.
Okay. That's great. Good for you. Do you have any ears, nose, or throat problems?
Nope.
Okay. Any cardiovascular issues other than your hypertension?
Nope.
Okay. Any lung problems?
I used to have asthma, but not anymore.
Okay. And what about any endocrine problems?
Nope.
Any gastrointestinal issues? Like, do you maybe get heartburn or?
Occasional heartburn.
Okay. What about neurological problems? Anything that you are aware of?
Nope.
Any immune problems?
Nope.
Okay, good. And what do you do for work, Mark?
I'm an accountant.
Okay. And do you drink, smoke, or do any recreational drugs?
I don't smoke or do drugs, but I drink socially maybe once or twice a week.
Okay. And so just to clarify, so today you're primarily concerned with your vision when you're reading up close?
Yep.
And that's it? There's no other concerns that you wanted to have addressed?
Yep, that was it.
Okay, perfect. Let's see if we can get to the bottom of this and improve your near vision.